We're at time, so I'm going to get started. I'm sure we might still have some folks filtering in, which is perfectly fine. So again, thank you all for taking the time this morning. Our webinar this morning is Health Information Exchange for Ambulatory Care, why it works and how you can make the most of it. So I know you're all busy folks, so again, we appreciate you taking the time. Just to give you a little bit of an idea of what you can expect today, I know we have a variety of folks. Some of you are already users with us. Some of you, this is brand new. So we have a little bit of something for everybody. So we're going to go over, our services. We're going to give you a little demo of them. For those of you that are already users, there's always something new to learn. We want to share some tips and tricks. We also want this to be interactive, so you are going to see some polls that are going to pop up on your screen throughout. So please feel free to answer those, give us some feedback. We do have a lot of information to cover in a small space of time, so we're going to get that done. But if you are able to stay on a little bit longer, at the end, we would really love to hear from all of you as well. We can have an open forum discussion. We'd really want this to be a collaborative session where you can all share what you're doing, what's working for you, your tips and tricks and ideas. So that's really the aim of what we're doing this morning. And you will get a survey at the end as well. When you leave the meeting, it will pop up in your browser. It's very short, quick, and easy. So if you did have a few minutes, any and all feedback is welcome. So we'd really appreciate it if you could take a few minutes to fill out that survey at the end as well. So to introduce myself, my name is Alex Agostinos. I'm a customer engagement manager here at HealtheConnections. I know some of you are very familiar faces. I've worked on your accounts with you, so some of you already know me. But just a little bit of background, before working at HealtheConnections, I worked in a specialty care surgical practice. So I helped implement HealtheConnections at that practice. I was an everyday user myself. So I've been there, I've done that work that you guys do, very familiar. And then very happy to now be here at HealtheConnections and sharing how great it is with everybody. So I very much come from that background. So I'm sure many of you are already somewhat familiar with us. And even for those of you that are, we've grown a lot over the past several years. So we have over 1,700 organizations that are participating with us. So all of those green dots you see on the map are our lovely participants, including most of you. So again, we've grown quite a bit over the past few years. There's over 11 million patients in our footprint that are receiving better care. So it's our 26 county service area that we cover, all the way from the Canadian border down through the central region, southern tier, and Hudson Valley. So within that region, we are the central repository for patient records and medical information from all of the different area hospitals, labs, imaging centers, primary care offices, specialty care offices, community-based organizations, mental health organizations, all different types of organizations that are sharing their data. That's over 600, close to 700 of those organizations that are sharing their data and making it available to all of these participating organizations. So it's over 4 million clinical summary documents that we receive per month. So again, very robust, so much information that's available right at your fingertips. And we have over 420,000 unique patients accessed per month. So, the proof is in the pudding. Those numbers show people are using our services, they're enjoying them, it's helping them, we're making their jobs easier, and just greater continuity of care for all of our patients. So quick overview of our services. Again, many of you might be familiar with these, but you might only be using some of them, maybe not all of them. For some of you that are brand new, we would really, love for you to see what might be able to help you. And we're happy to have those conversations with you if you're not already using these. So Patient Lookup, it's our real-time web-based browser that gives you real-time access to patient records. So that includes labs, imaging, medications, allergies, family history, social history, pretty much any kind of information that you can think of that's available right there in our portal. Included in our Patient Lookup is Image Exchange. So this allows you to view not only radiology reports, but those actual diagnostic quality images that go along with those. So patients don't have to bring a disc in with them. Your facility doesn't have to spend time requesting a disc be mailed from another facility, which I think we all know can take a lot of time. It's not an efficient process. In just a few moments, right on your web browser, you can pull up those images. We also offer our transfer to PACS service. So if your organization has its own PACS system for imaging, you can take any of our images and bring them right into your own local system. Our query-based exchange gives you access to statewide data. So as some of you may know, HealtheConnections is one of 5 RIOs in New York State. So those other regions that we don't cover are covered by the other RIOs, but that query-based exchange is again going to save you time and effort. It's going to return for you a summary of any of that statewide data that's available. Our My Results service, that's another tab within our system. So we're going to see this on our demo as well. It's going to query by NPI number. So any credentialed provider is going to see their own results there. And then other staff members can be designated as a delegate to view results for one or more providers. So it's going to query by that NPI number, return any labs, radiology, transcribed reports. So one quick, easy, consolidated place to get all of that information. Our My Alert service, it allows you to be alerted anytime patients are admitted, discharged, or transferred from the hospital or emergency department. I know a few of you had indicated that you were interested in this. We have lots and lots of different ways that we can customize how you receive those alerts and on which patients. So if you're looking for some customization with that, we're happy to follow up with you. We have lots of ways that we can do that for you. Our results delivery service is available with EMRs that have the capability. So any of our MedEnt, Athena, ECW folks, plenty of other ones, but I know those are some of the big ones. We can deliver labs, radiology, transcribed reports by NPI number directly into your EMR. So you don't even have to go to our portal to get that information. You don't have to wait for faxes to come into you or scan them in or spend time routing them from an eFax or some other system. We'll put it right in your EMR where you want it to be. Our direct mail is a HIPAA compliant secure email system. So it allows you to safely and securely exchange PHI with other providers or healthcare facilities that also have direct mail. So whether they have it through us here at HealtheConnections or through their EMR vendor, quick and easy way to securely send patient information. So great way to send and receive referrals, or if you're just consulting with other providers or groups on information. And finally, our My Data service. This service is going to take whatever information, if your organization is sharing data with us, combine it with all of the community-wide information that we have on your patients and organize that into easy to use dashboards for your analytics. So for example, there's an ED and hospital utilization report, can show you where your patients are going, what's been going on with them, pulls out some stats for you and takes all of that manual work out of your analytics. So now we're going to turn it over. So you've gotten our overview of services, and we would love to have you hear from somebody who is a daily user of them. So we have our guest speaker here. So Alicia Williams, she's from Syracuse ENT Surgeons. They were early adopters. They've been participating with HealtheConnections since 2012. So Alicia is going to tell you a little bit about how they use HealtheConnections, why it works for them, and why they love it so much. So I'm going to turn it over to you, Alicia.
Thank you, Alex. Good morning, everyone. Our office uses MedEnt as an EMR system, and we interface with HealtheConnections. So when we have new patients coming into the office, we click on the CCD from HealtheConnections, which helps us pull in data information on our patients before they even come into the office. And when they come into the office as a new patient, we have them sign off on the HealtheConnections consent. And from there, we have a huge amount of information on every patient. We use HealtheConnections sometimes for insurance information if we need updated insurance information. We utilize HealtheConnections on a daily basis with every patient we have connected HealtheConnections to. We use HealtheConnections for office notes, for lab results, for imaging reports. And instead of the patients coming in and bringing in a CD, or we're trying to get a CD mailed to us, we just go straight out to HealtheConnections, and probably 95% of the imaging we need to see is already on HealtheConnections. And our doctors love it. Their nurses pull up the imaging. The doctors can view the imaging in the room with the patient on the laptop. We would not be able to survive without HealtheConnections. When you log into HealtheConnections, you can look up patient identifying information such as current addresses, past addresses, And it's been such a useful tool for us. We do surgical patients in our office. And if we're looking for pre-op clearance notes, if we're looking for labs, EKGs, information like that we need, it is such a convenience to go to HealtheConnections and pull that information into the chart, because a lot of times we're working on last minute time frames that we need to get this information quickly. And understand, calling other offices and leaving a message or having somebody fax it to us, it becomes very tedious in that way. Sometimes the faxes come through, sometimes they don't. So we're able to get this information right at our fingertips. I just don't know where we would be without having the availability of Healthy Connection services. We have used it diligently. Any office out there that is not using it should definitely start to get into using HealtheConnections. There's so much information about a patient. I mean, it comes right down to patient's religion, patient's insurance information, you know, if they have a previous last name and a new last name, and it just, it's wonderful. It's wonderful service that we use. And because it interfaces with MedEnt, our office does share our records out in HealtheConnections as well. So every day or every night, all of our office notes from today will be interfaced out into HealtheConnections for the following day for any other provider to review. Some providers don't always put their notes out there. They put the date of service and the diagnoses they use for that patient from other offices. So sometimes we do have to call the office for the notes because they put very limited information out there. But the majority of HealtheConnections, other providers using HealtheConnections, we can get a lot of information. Well, now urgent care notes, surgical notes, pathology reports. I mean, you got it. They have it out there for you. And it's easy to help your patient understand, you know, it is secure, it's safe. And their information is already out there, but a lot of patients don't realize that. So there's a lot of understanding. You have to help your patient understand what is this database that we're using and how secure is it. And some people will decline it. They just don't choose to allow us. But the majority of our patients, once my front desk reception and I explain to them the process, they're like, oh yeah, great, go ahead, get our records. So I don't have to sign records releases so it's a great service. And I'm so proud to be, you know, sharing it with everybody that I can, because it's a great tool to use for everyday chart prep. So, and our nurses use it every day as well. Everybody in our office uses it. So that's about it. That's all I have.
Well, that was plenty. Thank you so much, Alicia. We really appreciate that. And I think you
You're
did
welcome.
a great job just kind of illustrating the real world uses and what it means to have it. So thank you so much. We really
Yeah.
appreciate that.
No problem.
Before I take the wheel back over, did anybody have any questions for Alicia about what they're doing or how they're using? All right, I'm going to keep going, but if anybody has questions, please feel free to type into the chat feature. If we don't get to cover them during the session, we're happy to email afterwards or follow up with anybody afterwards as well. So I think Alicia already did a great job of covering the benefits here, so I'm not going to spend too much time. I think she illustrated it perfectly. Again, you can see those real world uses of where this is just going to make your life so much easier and save time and make everything more efficient. You have that information right at your fingertips. When you have new patients that are coming in, I think we all know there's no standard way that we get referrals. Some offices are great. They'll send you everything you need. Other times you have gaps in your data, and this is going to fill those gaps for you. Again, you can do your chart prep. So we hope that our patients are going to tell us that they were just in the ED, but they don't all tell us that. So having this information again right at your fingertips where you have all of that information, it's quick, it's easy to view. You'll have everything before they even walk through the door, so you know exactly what you need to cover during that visit. And again, access to information right at the point of care. So when you have those last minute add-ons, a sick call, somebody that you weren't expecting to be in the office, they were telling you that they were just in the ED last night, you can pop right in and you'll have that information right at your fingertips. So we're going to take a moment here to jump right into the portal. For those of you that aren't familiar, you can see exactly what we're talking about. And for those of you that have used it before, we'd love to share some kind of tips and tricks for better ways to use it and to get the best experience out of it. So let me just switch my screen here. All right, hopefully on your screen, you should be able to see my HealtheConnections homepage. For those of you that are already users, you're familiar with this, but for those of you that aren't, this is basically your central dashboard for accessing all of your HealtheConnections services and information. So we're going to go right into the portal. We are in a demo site, so you are not seeing any real patient information. It's all de-identified. So last name and date of birth is the minimum amount of information that you need to look up a patient. So pretty easy and basic. I do always recommend using just that. If you start typing in first name, any other information, it's just putting more filters on and will actually probably take our system a little bit longer to query. So for fastest results, just last name and date of birth. You may have several patients, there could be patients with same last name and date of birth that you'll get a couple of options on your screen, but they will return faster. And if you look over to the right here or hover over, you are going to get a little snapshot so you can make sure you have the right patient. We're going to click in. So when we've clicked on their name and we can see their chart, that's going to indicate that this patient has given consent. If you haven't noticed before, right over here on the right-hand side, data is limited to the last 180 days. We do have full data on all of our patients, but when you first search, it's immediately going to return the last 180. So again, that's going to keep our system running a little bit faster for you. Usually the most recent is what you're looking for, but always be aware you can go back and look further than that. So on the left-hand side of your screen over here, you've got your patient action. So all of your controls. A lot of folks that are longtime users sort of forget that this is over here. So always good to kind of refresh your memory with what you have available. So you can either show the next 180 days of data if you know that what you're looking for is in that time frame, or show all data. And then we're going to hit OK, and then it's going to query the system for everything that's available, and it's going to populate all of those sections for you. So again, for those of you that are brand new or haven't been in here before, you can see everything's divided out into different categories. So it's very quick and easy to find exactly what it is that you're looking for. You can narrow that right down. You will find if you have patients with a pretty extensive medical history, which I'm sure we all have those patients, some sections may take a little bit longer to load if there's a lot of data in there. So that is sort of normal to expect. The little number that you see in parentheses next to each section, that's going to indicate to you how many records are available in that section. Oops, let me reload here. I apologize. I think that's my internet not being the greatest today. So another thing to note on your summary screen here, it's completely customizable. So again, with your controls that are over here on the left, you've got this great little button to configure layout. So I will say from my own personal experience, having been a user before, I used this portal for years before I ever really looked at that configure layout button. And when I did, it was a game changer as far as making it a better experience and easier to use. Give this a second here.
Alex, can I include something here really quick?
Yes,
for new users that want to use HealtheConnections and new patients, if your EMR interfaces with HealtheConnections and you hit that Get CCD button on new patients, that has also helped my office and the nurses to chart prep for that new patient. It helps us interface current meds, current allergies, all that information you need for a new patient. And this we like to use because if patients don't complete our new patient paperwork, putting up their history, medical history, HealtheConnections allows you to get that information.
Yes, thank you for sharing that, Alicia, and that's a great point. And again, it's not available with all EMRs, but with a lot of them and many of the bigger ones, again, are MedEnt, Athena folks, that document query, document retrieve function is great. So if you get the added bonus, you can share data with us. So your data is going to be available to everybody, but it also gives you greater efficiency when you can automatically query our portal right through your EMR. Great feature. Thank you for sharing that. So with your customized layout here on the left, you're going to see all of the available categories, and then you can drag and drop those in your grid to display however you would like. So I always recommend, once you get in here and you start using and you're kind of comfortable, the sections that you're in all the time and which ones are the most important to you. So just clear out anything that you're not really using. It's going to make that view a little bit neater, more consolidated for you. It will also load faster for you as well. So one of the ones that I always recommend, if you don't need to see vitals for if we're thinking about we're the HIE, we're getting records from hundreds of different sources, and there can be vitals, for every single visit. It's a lot of data. If you want to see that information, it's there for you. But if you don't need that, I recommend taking that one right out. It takes a while to load. If you want to speed things up, just consolidate that. So again, you have all the customization you want. You can arrange these whatever way you would like, as much or as little information displayed as you want. And it will always remember your settings. So you can change this as often as you'd like to, but every time you log in, every chart that you access, it's going to remember those settings, and it's per user. So you're not going to mess up the view for anybody else in your organization by making those changes. Okay. So another fun thing to point out, our labs are taking a second to load here, but you will notice they're flagged for you. So anything with a little exclamation point is going to show you that there's abnormal results contained there. So really great visual way to kind of get to the most important information. You'll notice on all of the records, when you hover over, you'll get this little snapshot that's going to give you some important information, the date, the ordering provider, where it came from. So again, quick and easy to parse through what the information is and what you want. Anything you want to take a closer look at, you'll just click right on the title. It's going to pull up those results for you. Again, they're flagged, so you can visually kind of get to the most important information. And you have the ability to download from the portal. So again, if you needed to save this and put it into your own EMR, you can do that from here if you don't have that functionality built right into your EMR. If you needed to print this, it will put it in a printer-friendly format. Hopefully we're using as little paper as possible. And the share and send to me buttons that you see at the top, those will link to direct mail if you have direct mail with us. So when you hit share, it's going to automatically put this result into a nice, neat, secure message that you can then send off to whoever you need to, and you know that you're doing that securely. Another function that I like to point out that a lot of times folks don't realize is there that's really helpful. If there's multiple items that you'd like to download, so maybe you're gathering everything from one date of service. If you use your little check boxes that are next to your items, you can choose as many as you want. You can choose from different sections if you want. And again, with your list of controls on the left, you can do download selected items as PDF. And when you do that, it's going to pop you a separate window. Anything you put a check mark next to, it's going to combine all of that information into one nice, neat document. So it saves you time of having to individually download each item and upload it to your EMR if that's the workflow that you're using. It just consolidates all of that into one nice, neat document for you. So that's a great feature. Again, a lot of folks don't realize that's over there sometimes, and it's definitely going to help you save some time. Many of you are familiar and saw from our poll really like our imaging features. So under your imaging is where you'll have all of your radiology reports. And then when you click into any radiology report, you'll see at the top you have this button to view this image, and that's going to get you right to that diagnostic quality image. So again, providers love this. It's right at their fingertips. You don't have to spend time loading a disc in. You don't have to have any special software downloaded on your computer to do that. Patients don't have to have the burden of bringing a disc. You don't have to spend time waiting for a disc to come in the mail. It's right at your fingertips. Under this View All Images tab is also where you can access the list of all of that imaging. And from that view, you can view multiple studies side by side. So if a patient had a CT scan done a year ago, one more recently, you can pull both of those up side by side, compare for changes. And anybody that has access to that transfer to PACS service, if you have your own PACS system, from this tab is where you can access that transfer function as well. For those of you that don't know as well, we were talking about earlier our access to statewide data and our connection with the other 5 RIOs in New York State. So right at the top with your tabs, you've got this button for statewide data. Also on the left-hand side with your controls, you have a button for statewide data. So just 2 different ways to get to that same information. So again, if you have patients, they've either recently moved to the area or they've traveled and received care elsewhere in New York State, Buffalo, Albany, Rochester, any of those outlying areas, you can get a summary of all of that statewide data right through that tab. So another great time saver that's going to give you a lot of information. Under your more patient information, a lot of folks don't kind of click over here, but there's some good stuff that's in here as well. Your consent tab here will show you a history of the patient's consent with your organization. So you can see that logged. If you don't have consent built into your EMR, this is also where you can change a patient's consent choice if you need to. The insurance info. This is a fun one to know that it's here. So you just want to keep in mind, we are not directly interfaced with insurance companies. So this isn't always going to be 100% accurate, but if a patient has used their insurance at anybody that's a data source with us that's sending that information, it will update. So this is a great place to go for a backup, because I'm sure many of you experience patients are not always the best at remembering to bring insurance cards with them, or they don't know their ID numbers. So having this as a backup is really nice to know that that information is there. Okay. Some other things to cover quickly as well. Up in the left-hand corner here, you have your My Results tab. So if we click over here, again, any credentialed provider is going to see their own results here, but other staff members can be designated as a delegate to view results for one or more providers. So depending on, how many providers you have or your workflows, if you have a nurse or an MA who works with a particular provider, it might be really helpful for them to have that particular provider's information. So when you click submit, and again, you can see you've got plenty of customization to what information you'd like to see. It's going to query by NPI number and return all of those results. Just like on your summary screen, it's going to flag for you anything abnormal, and you've got all that same functionality to view or download from here as well. Okay. So those are some fun tips and tricks in our portal. A few of our other services that we'd like to take a look at as well that we were covering earlier. Back on our HealtheConnections homepage, over on the left-hand side here, you probably won't have as many badges as on my demo screen, but any service that you're signed up for, you'll have over here. If there's something you see that you don't have, then reach out to us. We're happy to work with you to get access. So My Alerts, again, we have lots of different ways to customize how you receive your alerts. But this is just kind of a little preview to show you what they look like in our portal. Oops, looks like it logged me out. So bear with me 1 second here to hop back in. And I'm sure many of you are familiar with our sign-in process, which does involve MFA or multi-factor authentication. And that's just to keep everything extra secure. So when I pop into that My Alerts badge, if you're configured for this, you can do any date range you want. So again, depending on your workflows, a lot of people, maybe you want to see the last week's worth of information. You just want to see your ED discharges, and then it's going to return for you that information. You'll get a nice list of who those patients are. When you click over in your details here, it's going to show you the reason that they were there, their discharge disposition. Again, some really great information to have right at your fingertips. Also quickly, I want to pop into our My Data service, which I have open right over here. So this service, again, it's going to help you with your analytics. It's going to automatically pull out some information for you. There's lots of different reports available in here, but just for an example, this is our hospital and ED utilization report, which is very popular. So you'll see it's going to pull out for you and show you and give you a year-by-year comparison of where your patients have been going, what's going on with them. Again, lots of ways to filter through that information. We have a lot of folks that are using this. They will filter the date to just show them the last 2 or 3 days. They want to follow up with those patients in a timely manner, make sure they're getting them in for appointments, and this gives you that information right at your fingertips. There's also these fun little buttons that will pop you right into the patient's chart in the HIE. So if you wanted some more information, there's a snapshot button that's going to pull out some information quickly and easily for you. And again, you'll see it does some of these analytics automatically for you. It's going to pull these numbers of patients that were readmitted within 7, 30, 60, 90 days. So all of this great data and information that's right at your fingertips and automated. So I know hopefully some of you can stay on a little bit longer. I know we're at about half of an hour here, but we do have some other things that we'd love to share with you. So if you do need to pop off, that's fine. We are recording the session as well, so that'll get sent out to everybody. But if you did have a few more minutes to stay, we're happy to cover some more things with you. I'm going to go back over to my slides. So most of you are probably already familiar that patient consent is required in order to access information in HealtheConnections. The good news is that consent process is pretty simple and easy. Alicia touched on that a little bit for us. The consent is per organization. So again, patient might see a primary care physician. They might see several specialists. They would need to sign a consent form with each one of those organizations, and they might sign differently. So they may give consent to their primary care. They might deny consent to a specialist, completely at the patient's discretion how they'd like to handle that consent. But as long as you have your most updated consent form for your organization, you want to make sure that that's being used. I recommend that you just build it right into your registration process when you're adding new patients, or if you don't already have your patient population consented, build that in when they come in for a visit. Just collect consent on your entire patient population. That way it's there, you have it, it's right at your fingertips. You don't have to make it a big process to get the information. It only has to be collected once, which again makes it easy. It's not like some of the other forms that you might deal with that has to be updated annually, where you have to have a tracking process. Once patients given consent, then you're good to go. You can access their information in HealtheConnections at any time. Patients can change the consent choice anytime they'd like to, just by notifying you that they'd like to do that and filling out an updated consent form. But the good news is 95% of patients who are asked about consent say yes, which is a fantastic rate. And I think most of you will probably see that that is the information that you get, and that you find that patients are pretty apt to say yes. Patients tend to really understand the value. Again, they don't have to remember all of their medical history or bring records with them. So it makes their lives easier, and they typically want everybody on their care team to be informed of what's going on so that they can get the best quality of care. So that process, again, is very easy. Can't refuse care to patients that don't give consent. So even though your staff may be getting the same information by calling or faxing that they would have gotten if they got it from us, it just takes twice as long, but you still are going to go about treating your patients the same way that you normally would, even if they don't give consent. But again, with that power to change their consent choice anytime, the good news is if a patient does say no, and then a few months down the road, they realize it would be really great, they can always fill out a new consent form and update that consent choice anytime that they'd like to. And again, speaking from my own experience, very few patients that denied consent. The few that did Usually they would change their minds when it came to be like a real world example. So they're in the exam room, they had a imaging study done, the provider wants to review it with them right then and there, but they don't have the disc. When we then say, well, if you want to sign this Healthy Connections consent form, the provider can pull this image up right now and they can review it with you. Otherwise, if you don't want to do that, we'll have to call you back or we'll have to schedule another appointment to follow up later. When they kind of see that real world, oh my gosh, I'm gonna get my care more quickly, the provider's gonna have everything they need, then they'll be like, yes, I absolutely want to sign that consent. So sometimes it's just a barrier that the patient isn't quite understanding, but when they see that real world example, then they see why it's going to help them get better care. And also you want to make sure your staff is well trained on how to explain that consent to patients. We usually find the simpler you keep it, the easier. Let them know that it gives you access to their records. It's going to help them get better care, and they're usually pretty apt to say yes.
Alex, can I just interrupt for just a minute?
Yes.
When our patients come in and do the consent, we have them sign on the signing pad and we choose the consent they want. So it's adult given HEC consent, adult denied, or emergency use only. And on those actual documents from Medent, whichever one the patient chooses automatically interfaces over to HealtheConnections. So whatever consent they sign, our Medent system converts the patient's answer by the consent we choose, and then it automatically unlocks HealtheConnections for us. So a patient comes in today, a new patient, and they give us consent, I can immediately go out to HealtheConnections, log in, and I already have access. I don't have to manually enter the consent into HealtheConnections. That's also a great interfacing feature for everyone else to know.
Yes, thank you again, Alicia, for sharing that. And again, this all depends on what EMR you're using and what its capabilities are. But again, many of the big ones that you folks are using have those capabilities. And just like Alicia was saying, it's going to make the process a lot more streamlined for you. So now we didn't go too far over time. So we would really like if anybody wanted to share. We do have some questions kind of built in here, but I would like to just open up the floor if there's anything that anybody wanted to share or any questions that they had. Please feel free to chime in and we can have a little discussion.
Alex, there are some questions in the chat box if you want to address those. I know Michelle was asking Alicia some questions.
Okay, so I see Michelle was saying local hospitals are not always in HealtheConnections prior to the visit. So you're looking for a paper copy of their discharge. So this could be a couple of things. One thing I do like to point out, particularly with hospital discharge summaries that we find comes up sometimes, those records are not going to come over to HealtheConnections or flow to us until a provider has signed off on that record and closed it out within their EMR. So occasionally there will be delays in information coming over because of issues at the source of the data. So that is something to keep in mind. And sometimes if you call the hospital, they might be able to give you a preliminary report or something that hasn't flowed over to us yet. It could also be where you're looking in the portal. So I do know not all of our hospitals send information in exactly the same way. So there's the transcription section in our portal. A lot of hospital discharge summaries will be in that transcription section. However, depending on how the data source is sending, sometimes they go over in documents. So there is a document section on your summary as well. So if you're not looking in both places, sometimes I would recommend that, because depending on which hospital is sending, it could be in either one of those places. So hopefully that answers your question, Michelle, but any other information or feedback that you can give us on that?
Yeah, I do understand the concept of that the provider has to sign for it to come over. I feel like though, because I work for two places that he's essentially a primary care, but he sees patients who get discharged from the hospital and go into long-term care or short-term rehab. And the main hospital that I always can never get information on is from Kraus. So I don't know if they're that like severely lagged, but the patient themselves will come with a packet, which like you said, could be preliminary, but they have all the information I need. It's just in paper form and I just don't see it in HealtheConnections.
Okay, so I do know that recently we had identified some issues with how Kraus was sending information over.
Mhm.
A lot of details on that, but we can find out some more information and follow up with you after. Also, if you're able to gather some specific examples, like some patient names and dates of birth, some of the information that isn't there,
Mhm.
and pass that over to our support team, we would love to take a closer look at that just to make sure that there isn't a technical issue going on. Or if the information is, again, maybe it's sort of hidden somewhere that you're just not seeing it. But we would definitely love to get a little more information from you about that, and make sure that that information is getting to you.
Okay, and I also have another question. Is there any like future programming or ideas to kind of streamline where the data flows? Like you were saying it goes in transcriptions or could be in documents, and I'm reading the response in the chat that I had asked about for office visits. It could be under office notes, documents, or there's a summarization, or there's like an ambulatory button. I just feel like I'm in a hunt. And when I saw you say I could customize my layout, I'm thinking of all the things that I want to get rid of. But in reality, those are places I guess I have to be looking for data.
Yeah, it's gonna definitely depend, it's gonna be a little different for everybody depending on what information is important to you, what you want to customize on that screen. I would love to say that, yes, we're gonna streamline everything, but a lot of that is sort of out of our hands because we interface with so many different systems, so many different EMRs, so many different organizations. And unfortunately, in the healthcare industry, it's not really standardized. There's some standardization as far as like a CCD and what that format is, but there isn't really a set standard for every EMR has the data entered this way, and every EMR sends the data this way. And even within an EMR, the way that different organizations choose to use that EMR and where they're entering the data can vary from organization to organization. So unfortunately, because of those kind of technical things, and that lack of standardization, that part's sort of out of our hands a little bit, as far as where it's going to go, because a lot of it's more on the technical end as far as how that data is coming over.
Yeah, I've had to search a couple of different places within HealtheConnections, but usually I find it wherever, if it's under transcriptions, if it's under documents. When you get into HealtheConnections and you just go out to explore and click under every single tab that they have out there, you kind of get your groove on where these notes are going to be. So a lot of my nurses come to me and they say, I need to find this document and it's not under here. And I'm like, oh, because that's under summarizations, and I'll find those well-now visits. I'll find all of those notes in different areas. But it just, when you start getting into HealtheConnections, you'll know, okay, they're not out there. This company, they put their notes out here in this way. It's you getting familiarized with where to find it. But yeah, it's usually out there.
And I think did somebody have a hand up? Was there another question?
Me. I'm Christina. Good morning with everyone. Thank you so much for having this Zoom meeting. I have three questions. The first one is, we work with ECW. It's a different type of EMR. And after mid of this month, we start receiving, like, I am the patient navigator for Dr. Samuel Cohen and Gloria Tatsapu. I run two sites, Dover Plains and part of the Armenia side. After mid of the month, we start receiving this P2P, we call it, is peer-to-peer medical records. And all of them come from HealtheConnections. But the way that they are sent is is labeled as new unsolicited alert from HealtheConnections. So it comes to one part and two part of the documents. It emerged in my P2P because I am the one who filtered these documents, label them, date it, and send them to the provider. This is hundreds of documents. And in the moment that we receive it, we don't know who's the patient. We need to go in there, actually open an attachment. And this attachment only said this patient was seen in the ER this date, and that's it. And it doesn't have actually a report, doesn't have, you just have a location, but then I have to go through my regular inbox of faxes to find the nice report you guys send us after 2 or 3 days. So I don't know if this is something new that we have to talk with the agency, like you were saying, each ECW MR system have a different way to approach. This is the first time I ever see them. So I see myself cleaning hundreds of P2P documents that are repetitive. So on one attach says numbers and letters, and the other attach come as a note attach. And it's a repetition of that the patient was there with this alert notification. I was wondering if this is something that have to be addressed with our IT department with you guys, is something that the other institutions are seeing. And that's my question. That's the first one.
Okay, yep. So that does probably sound like something you're going to want to touch base with us, and then we'll take a look at it and possibly have to get involved with ECW. A lot of those types of things, it's helpful when we have specific patient examples. But just kind of based on what you're saying, it sounds like maybe there's some settings in ECW that, yeah, you might need to have tweaked. Or again, with our alerting, we have a lot of different configurations for how we send alerts. So we might need to revisit with you what kind of alerting you're configured for, and maybe we need to make some changes there. So we would love to, maybe we can follow up after the webinar and get on a call with you and get some examples and look at what's going on. But we do hear this from other organizations. And again, a lot of times it just depends on how your alerting configurations are set up and what your EMR settings are.
Awesome. My second question is, when we generate a report in HealtheConnections, I personally work with 2 doctors that are in really fast type of paperwork, and they say, just get me this report now. So the report that I am printing, and I don't know if maybe you can guide me in the settings. I don't know if this is doable through the settings. When I print a report from the ER, it comes with 3 pages of only insurance information in the top. So my doctor decided to say, you're never giving me this paper ever again. You give me a nicely report as the doctors send it, you know, the finished report that come in my fax machine. So to be honest, I'm using you guys basically for my pre-authorizations in any kind of images that I'm doing. And if it's an emergency, I just have to chuck the other 3 pages worth of insurance. If there's a actually setting that will take care of that information that is irrelevant and it consuming of paper.
Yep. So I know exactly what you're talking about, because when I worked in a practice, our providers said the same thing. We don't want this stuff, right? They don't want to sift through it, which is completely understandable. We've heard this from some other organizations as well. So we currently, right now, there is not a way to remove that. But sort of as a temporary workaround, we recommend if you scroll down to the page where your report starts and then just print from that forward. So if you change the pages in your print settings to exclude those, that's sort of a short-term answer. Again, we've heard this feedback. We are, currently right now, we are working on a lot of upgrades and changes in the background. Don't have an exact ETA of when those things are going to be rolled out. But that one is one that we've definitely heard before. So that's feedback that we have, taken in and taken into consideration. So hopefully in the near future, you are going to see a change there. I don't want to make a promise I can't keep. I don't have an exact time frame, like I said, of when that's going to happen. But we do know that that's a common feedback that we've gotten, that people don't love that. So we are, looking to update that and make a change there. But for right now, the best suggestion I would say is to just start your printing from where the report starts.
Perfect. And the third question is, I deal a lot with consent forms. Most of the time, my verbal consents are the annually consent that they have given us to get records. It's a generalized consents to exchange P2P through records. If this is something that I have to keep in the patient record with HealtheConnections, like for example, we do have a generic consent form that is signed with the patient, come to the office once a year. And this is a very broad concern that I use for any request of records. Now, there's a different hospital, Winchester Medical Group, they actually require their specific consent form. So when I just press the consent for the patient, I just put yes. I don't even, well, I know that I have a consent already signed for the patient, but I just go yes, 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 yes. It doesn't matter. Is there any consent form that HealtheConnections have created for a specific type of patient? I also deal with a lot of patients who have MR, mentally retarded patients with disabilities. And I do require consent from the taconic or the center that they're being held, which I keep as medical records part of my custody, right? So is there something through through HealtheConnections that I should know about this type of patients, or patients who are records are being protected by federal laws that we should be aware of?
So just to be clear, so you should have a HealtheConnections specific consent form that's signed by the patient where they're making a consent choice if they're either allowing you or not allowing you to access their records in HealtheConnections. So in order to access any information in HealtheConnections, it does have to be that specific HealtheConnections consent form. No other, general consent forms or things that you might use for records requests or other purposes, that does not apply to accessing information in HealtheConnections. You do have to be using a HealtheConnections consent form for that purpose. And if you, hopefully you have that form. If not, we can follow up with you.
No, I don't have it.
Sure.
I don't have it. Sadly, when you guys came to Armenia in the meeting, I wasn't there. So I have learned everything by self-teaching. And I
Sure.
thought that there should be something put in the patient. So I didn't know if I skipped the record, because I do have my own consent form that they have it and says, get records for whoever you want it. And I also use the individual consent forms from each of the hospitals I go. So with that, I defend myself. Usually I will fax it to Sharon Hospital, to all the Nuance health practices, one individually one, but I don't have, and I will love, please, when you have the chance to send me a copy of the HealtheConnections consent form for each of the patients. So I will cover my nice plug. Thank you.
Yeah, not a problem. And I'm going to share, hopefully you can see on my screen. And again, hopefully everybody's familiar, but if not, this is sort of a sample of what our consent form looks like. So it says HealtheConnections up at the top. You need patient's name and date of birth. They make that choice and they sign and date the bottom. And I know you mentioned you have some patients with MR. So a patient, if they have, a health proxy or somebody that's with them, a legal representative, that person can sign on their behalf. And there is a separate box for that person to sign and indicate what their relationship is. So it may not always necessarily be the patient themselves signing the consent form. In most cases it is, but if they do have somebody that's going to sign for them, there's a spot for that. You are required to keep these consent forms on file for a minimum of 6 years. So whether it's the actual, if you're using a hard copy piece of paper, you're filing that somewhere, or if you're scanning that into your EMR, or some of you may have the consent form that's just integrated into your EMR. So, somebody's just clicking a button in the EMR that corresponds with this. However you're collecting it, you do want to make sure that you have some kind of record of this consent being collected.
Yeah.
And it can be audited as well. So these consents are subject to auditing. So you may be given your annual audit. They might give you a sample of patients that, they want to see that there's a consent form. So you do want to make sure, for compliance purposes, that you have the correct, most up-to-date form. These forms have been updated a few times over the past several years. So always a good idea for any group to take a look at your form, make sure you have the most updated version, make sure you have the right choices on it, and that you're keeping those as part of your records.
And these have to be applied only to when we search on the patient, only if the patient said you need a consent form, or to all patients that we actually submitted request information?
Oop, I'm sorry, could you repeat the question?
I said the consent form have to be signed only when we search for a patient and it says you need a consent form, or to all the patients we're looking for records in Health Connections.
Yep, so this is needed for any patient. You really shouldn't even search a patient that you don't have a consent on. And if you do, it's probably gonna pop up in our portal saying like access denied. But best practice, like I was saying, I just recommend you collect a consent form on all of your patients. That way you're covered, even if you don't end up looking up any information on somebody. If in the future you ever need to, you have the consent form, you're compliant, you're set. So that's why I always recommend just building it into your regular workflows. But yeah, you should not look up anybody, or if you do look them up, hopefully it's going to tell you that you can't access their records, and you shouldn't be accessing anybody's records that you don't have a signed consent form for.
Okay, thank you so much.
You're welcome.
Alex, you have a question from Karen Griffin and Gail in the chat box.
Thank you. Let's take a look here. Okay, so I see we have a question about getting duplicate records. So you're getting them in a fax line and then also in your direct connection. So we hear this from a lot of groups as well. So typically we recommend if you are getting results from us, whether you're pulling them from our portal, whether they're being queried by your EMR or from results delivery with us, any of those sources that we are delivering the information to you, that's usually an automated process. It's efficient, it's putting it into your EMR. So you may want to reach out to those sources and ask them to turn off their faxing. And we do find that sounds like a really simple ask. Sometimes, depending on the organization, it's not always an easy ask, particularly with our hospitals. They're very large, they have a lot of departments, so turning off a fax, it can be a little difficult, but it's not impossible. So we do recommend that you reach out to whoever's sending you faxes and ask them to discontinue sending those. And if you do run into any trouble with that, or you're not getting to the right person, reach out to us, because we have a lot of contacts at these organizations. I've recently worked with a couple of different accounts that needed some help getting their faxes turned off, and it took a little bit of time, but we were able to get to the right contacts at those data sources and get those faxes turned off. So that's definitely something we can help you with if you need help with that. But we always recommend just turn the faxes off, because it's a lot more efficient to just have it delivered into your EMR for sure. And then we had another question about obtaining a direct address to update our EMR. When searching a provider, my search is not always returning results. So Gal, if you're still on the call, I don't know if you could just give me a little more information on that. Are you talking about results that are being delivered into your EMR, or are you searching in the My Results tab in our portal?
No, I'm searching on HealtheConnections, the direct address, so that I can
Oh, a direct
obtain,
mail address?
yes, so I can obtain the direct address to add it to that provider that's in our EMR.
Okay.
And so when we need to create a communication to that provider, that direct address can be used.
Okay, gotcha. So you're searching within our direct mail that has that provider directory, and then you're adding those because you're using the direct mail through your EMR. Is that correct?
Correct.
Okay, gotcha. So if it's not always, it could be not returning a result because that person doesn't have a direct mail. If you're coming across ones where they do have it and it's not coming up, anytime we can have a specific example and send that directly to our support team, support@healthyconnections.org, or you can call them, just give them the name of the provider who, like, if you know they have a direct mail address, it's not coming up, and we can take a look at that and see if there's
But that's the point. I don't know if they have a direct address. That's why I'm using your database to obtain it. So I wouldn't even know whether really that patient has one. Yes, I have access to MedEnt to go look at one to see if one exists for another provider that might be in their database. But I wouldn't know that whether a provider has a direct address or not.
Yeah, so what that could be the issue though, if you're searching and they don't have one, then they're not going to come up. Unfortunately, we don't have the ability to have every single provider to say they don't have one. So yeah, I'm not sure. Maybe we could look at that a little bit deeper. But just right off the bat, I mean, if they don't have one, then they're definitely not going to be showing up.
And I thought maybe something was set on my filtering too as well. So I'll put a ticket in with support and have them look
Yeah,
at a
so we'd
couple.
love to take a closer look just to make sure that everything, it's nothing, if there is something on our end, we're happy to get it fixed. But if it's just that they don't have one, then unfortunately, that's a limitation. Any other questions or anything that anybody wanted to bring up? Or share, something that works well for you?
I'm going to add something in here. Sometimes when I go out to HealtheConnections and I'm searching for a patient and one patient has multiple charts within HealtheConnections, I automatically send an email to support and say, here's the chart number, your chart number for this one patient. I never put name and date of birth in there. I always use your identifiable chart for each patient and say, this is the same patient. There's multiple charts out here. And then HealtheConnections will go out and merge them for us, because some records will go based on the provider that enters their name into their EMR and it interfaces. You could have multiple charts out there. And if you do, you have to search both of those, put the consent in for both of those in order to search both of those charts. So that's also something you guys should keep in mind as well, because I know I've had to do that multiple times. One initial is in the patient name, one initial isn't, but I need both of those. So HealtheConnections is really good about calling them. Somebody's always there to answer. And when you send a support ticket via email, I always get a response in quick time. So they're really good about that.
Yes, thank you for sharing that, Alicia. And Carol in the chat was also pointing out, you can send any of those duplicates that you come across. If you have direct mail with HealtheConnections, you can securely send the patient name, date of birth, any information to us in direct mail as well. But yes, as a workaround, if you do come across that, you can enter the consent in both charts, but we do want those things reported to us so we can get them merged, keep the data clean in there. And like Alicia was saying, it's usually due to a data source. If they enter a patient in a slightly different format than everybody else, if they have, if they misspell a name by one letter, or again, if they have a middle initial and somebody else didn't, little technical errors like that are what can cause a duplicate chart. But again, we try as best we can to keep our data as clean as we can. So please do report anytime you see those things. Our support team and our technical folks on our end, they are very diligent and thorough about that. They'll do the research as well to make sure that it isn't, wrong patients that are being merged or anything like that. Very rarely, but sometimes we have had where there's similar names and the wrong records go into a patient chart. If you see anything funky like that, again, please report it. We try to keep our data as clean as possible. So anything like that, we'll make sure we go in there, investigate it, get it all cleaned up so that it's good to go for everybody. So we had a few open discussion questions on the slide. If anybody wanted to share any, that would be great. I know we are about half an hour over time here, and I really appreciate everybody's time and you guys sharing everything. So if you need to drop off, that's fine. We'll stay on for a few minutes because again, we really want this to be a collaborative discussion. If there's any other questions anybody had or anything else they wanted to share, we're happy to hear. But we really appreciate everybody's time. And again, when you leave, there should be a survey that pops up in your web browser. It doesn't take very long to fill out. It will just be right there in your web browser, so if you can't get to it right away and you want to do it later. But we definitely do appreciate any feedback that you can give us on our webinar here.
Alex, there's a few things in here that are new to me. So can I reach out to you, or should I reach out to somebody else specifically to go over some things that I learned in this webinar with you that I wasn't aware of. How should I go about talking with somebody about it?
Yeah, yep, you can absolutely reach out to me, or you can reach out to our support team and they'll hook you up with somebody. Either way is fine. We've got plenty of resources here. We're happy to help. So yeah, please feel free.
Awesome. Thank you.
Mhm. All right, anybody else? Don't be shy. Anybody have any questions? Anything they want to share? All right, if not, I'm going to go ahead and end the call because again, I know we're a little bit over time. Again, we really appreciate everybody's time. We love hearing from you. Any questions or any troubleshooting or any services that you aren't currently using that you'd like to use, please feel free to reach out. Again, myself or our support team, we're happy to talk with you and get things implemented and help you out. So thank you so much for your time and I hope everybody has a fantastic day.
Thank you. You too.
Thanks.